What if a single scan could replace blood draws, pain scales, cardiac monitors, and nerve conduction tests? That question sounds like science fiction, but the real question is, why are we still doing it the old way? A patient walks into a clinic in pain. The doctor asks, on a scale of 1 to 10, how bad is it? That's the state of pain measurement in modern medicine, a number, picked by a patient based on how they feel at that moment. It hasn't changed in decades. Now the blood work, a needle, a vial, a courier, a lab, results in hours, sometimes days. Meanwhile, the patient waits. Cardiac assessment requires electrodes taped to the chest, monitors strapped to the body, expensive equipment that most primary care offices can't justify. And neuropathy? Nerve conduction studies. Electric impulses sent through the body to measure nerve damage. Painful, time-consuming, specialized. 4 critical diagnostic areas, 4 separate systems, 4 separate workflows. None of them talk to each other. And every single one requires either physical contact, invasive procedures, or subjective interpretation. This isn't a future problem waiting to be solved. This is every clinic, every day, right now. QDigipass changes that. 4 diagnostic modules, 1 unified platform, and nothing ever touches the patient. The Quantum Digital Physiological Assessment System captures physiological data through photoplethysmography, light-based pulse measurement from a simple sensor or a standard camera aimed at the patient's face. From that single signal, QDigipass extracts what used to require 4 separate invasive processes. Start with pain. QDigipass replaces the subjective 1 to 10 scale with the pain entropy index, an objective real-time measurement derived from spectral entropy analysis of the PPG signal. The system reads physiological pain signatures that the patient can't fake and the provider doesn't have to guess at. A score between 0 and 1. Reproducible, documentable, defensible in any clinical or legal setting. QDVSA delivers comprehensive cardiovascular assessment, heart rate variability, stress analysis, cardiac risk factors, chest pain differentials, in real time. No electrodes, no monitors strapped to the body. The same PPG signal, interpreted through a different analytical lens. QDVBA is the virtual blood analyzer. Complete blood panel results, CBC, metabolic panel, lipid panel, derived from a remote facial scan. No needles, no phlebotomist, no lab, no wait. A camera looks at the patient's face and returns what used to require a vial of blood. And QDNA, neuropathy assessment, severity levels by anatomical location, autonomic function, sensory and motor evaluation, all from non-contact quantum-inspired RPPG analysis. No nerve conduction study, no electric impulses, no discomfort. The patient sits, the system reads, the results appear. Here's what's happening beneath the surface. A PPG sensor or camera captures subtle light fluctuations in the skin caused by blood flow. That raw waveform is filtered, segmented, and analyzed for spectral entropy, a measure of complexity and disorder in the signal. A healthy, pain-free cardiovascular system produces a relatively ordered signal. Pain, cardiac stress, blood chemistry changes, nerve dysfunction, each introduces distinct patterns of entropy that the system can identify and separate. The system uses a quantum-inspired mathematical framework, not quantum computing, quantum mathematics, Hilbert space, vector representation, and probabilistic projection to model physiological states that are inherently uncertain and multidimensional. This gives QDigipass the mathematical precision to separate overlapping signals and deliver clinically meaningful outputs from a single data stream. Machine learning classifiers trained on clinical data validate every output. Nested cross-validation, stratified sampling, pre-registered endpoints. The science is structured for scrutiny. QDigipass sits at the intersection of 3 markets experiencing explosive growth. Point-of-care diagnostics, a $33 billion market today, projected to exceed $60 billion by 2030. AI-powered remote patient monitoring, $2 billion in 2024, racing toward $8.5 billion by 2030, nearly 28% annual growth. Non-invasive monitoring devices, $23 billion today, projected to double within a decade. The shift from invasive to non-invasive, from hospital to point of care, from subjective to AI-driven. QDigiPass rides all three waves simultaneously. The target market is every medical provider in the country: solo practices, group practices, urgent care facilities. The platform requires no specialized hardware beyond a camera and a PPG sensor. Adoption is immediate. 3 subscription tiers: basic access at $1,200 per month per provider, intermediate at $2,400, full platform access at $3,600. Volume discounts for institutional providers. No competitor offers all 4 diagnostic modules from a single non-contact platform. Existing solutions address one domain. QDigiPass replaces all 4, and because nothing contacts the patient, it holds a critical regulatory advantage. Completely non-contact means QDigiPass does not require FDA device approval. Competitors with contact-based devices face years of regulatory process. QDigiPass bypasses that entirely. Copyright is filed. Patent registration is in progress. The intellectual property is being secured. Clinical validation follows a 4-phase translational roadmap. Algorithmic robustness, controlled clinical validation, multi-site trial, post-market surveillance. Rigorous, structured, and built to earn confidence. Picture this: a patient walks into an exam room, sits down. A sensor and a camera do their work. Within minutes, the provider has an objective pain score, a complete cardiovascular risk profile, a full blood panel, and a neuropathy assessment. No needles, no electrodes, no waiting, no guesswork. Every exam room, every surgical suite, every urgent care, every clinical trial, one platform. QDigiPass was created by Dr. Thomas Sharon, a nurse practitioner with a doctorate in nursing practice, a master's in public health, and 47 years of healthcare experience, a published author and medical innovator, the first clinician to establish treatment protocols for COVID-19 in primary care, and the first provider to use RPPG in telehealth to diagnose COVID-19 complications remotely. He didn't theorize about this technology. He used it, in practice, on real patients during a global crisis. And then he built a platform around it. QDigiPass is raising $500,000 through a private offering. Clinical validation, patent registration, platform development, market entry. This is the ground floor of a platform that could transform diagnostic medicine. Dr. Thomas Sharon, QDigiPass, the future of physiological assessment.